The Regis University School of Pharmacy here I think is pretty unique for a couple different reasons. One is the structure of the program is much different than most programs nationally. So we have a curricular structure which uses a couple of different unique aspects to it. One of which is team-based learning, the other which is integration.
Our curriculum is integrated. So we teach everything about one state disease, for example. We teach that all together.
Our science-based courses, so for instance, most typical courses like biochemistry or biology, are integrated into our discussions on drug therapy and how to treat patients. The integration aspect of the curriculum I think is important because it helps tie the scientific principles to the drug principles. And so learning those at the same time and helping apply those to real patient scenarios, I think helps the students kind of see the value of it and also the application of that in what they'll be doing in their clinical practice on a direct patient care level as well. The team-based approach, rather than working in a lecture format, has the students work with each other throughout the course of the curriculum. So this helps foster great interpersonal and communication skills. And we get good feedback from our preceptors and our employers that our students come out with the ability to interact well with others and participate in a team format as well.
Here at Regis, instead of telling students what's in my notes, we give them our notes well in advance so they can prepare for class. They're motivated to study. And I'm more of a designer of learning experiences rather than reading what's important.
Not only do our students work in teams, but they're also exposed to nurses, physical therapists, and doctors during their education. In healthcare today, it's a team approach, and so I think learning in teams and then being able to engage with other healthcare professionals has really set our students apart and prepared them for the next steps, really stepping into their careers.
We're seeing more so a trend now for students who are coming into the program who may want to end up in a more research-focused career afterwards. And certainly we have a core group of faculty that participate in research who often work with our students to get them involved not only in laboratory research but other aspects of research as well. There's a natural fit between the Jesuit values and the delivery of healthcare. So for instance, one of the core Jesuit values is cura personalis, which is care for the whole person. So as we work through the curriculum with our students, we not only focus on the drug knowledge that they need to treat the patient, but also the skills to interact with the patient, be compassionate, empathetic, so that the patient feels as though they're being taken care of and not just their drug therapy is being taken care of.
It's very important, our focus here on clinical practice. So we are preparing pharmacists to take care of people. Service learning being integrated in our curriculum, that's extremely important from my perspective. Because when they go out for that type of activity, they learn things that I cannot teach them in the classroom. Service learning, our concern about the community around us and all that. I feel that that's beautiful, and I feel that that has a great contribution for us to prepare the pharmacists that we are preparing.
Prospective students who are considering pharmacy as a profession, it's an exciting time to be in the profession. There's lots of changes which are getting the pharmacists more involved in direct patient care and higher level clinical services as well. We do have career fairs where our students get to interact directly with employers from the metro area. And this is an opportunity for them to network, potentially get jobs as interns, which then could translate later into jobs after they graduate. We also hold various educational sessions on other opportunities, like for instance, postgraduate residency training. So residency training is quickly becoming very popular, particularly for students who want to participate in high-level clinical jobs when they leave the program as well.